Hi everyone, my name is Courtney Felly and I am the YARR Program Manager at the Every Life Foundation for Rare Diseases. I'm excited to welcome everyone together virtually to celebrate the 2022 YARR Leadership Academy graduating class. I want to thank our 2022 sponsors, facilitators, and others who made the YARR Leadership Academy possible. We really appreciate your support investing in the next generation of rare disease advocates. The YARR Leadership Academy includes a select group of dedicated young adult advocates in the rare disease community. In a series of online classes, Leadership Academy students learn about the roles for patient representation in policymaking, drug development, and the regulatory process, and gain skills to enter those roles. I encourage you to scan the QR code here to learn more. To kick off graduate speeches, I'm delighted to welcome our keynote speaker, Evren Knight. Evren is a graduate of the inaugural 2021 YARR Leadership Academy class and a committed advocate in the ASMD community. Evren spoke in front of the FDA in 2017 and was involved in advocating for what is now the first FDA-approved treatment for ASMD as of August 2022. Evren is also the co-author of Extraordinary, a book for children with rare diseases, and a 2020 recipient of the prestigious Torch Award for Rare Disease Advocacy, with which he endowed a scholarship fund for students with ASMD. He now attends California State University, Fresno, studying to become a special education teacher. With that, I am pleased to pass the proverbial mic to Evren Knight.
Hello, YARR graduates, Every Life and RDLA staff and leadership, family and friends. It is an honor to have a few moments to speak to this year's YARR Academy graduating class. My name is Evren Knight, and I am a YARR Academy graduate of Spring 2021 and a rare disease advocate. One of the most memorable days of my life was on February 13th, 2018, when I spoke to an audience of experts about my life with the rare disease acid single myelinase deficiency, or ASMD. 4 years and 6 months later, the FDA approved an effective treatment for ASMD, which was a tremendous victory made possible by the efforts of scientists and advocates. Today I want to share with you 4 key points about my trip to the FDA, as well as 3 ways that participation in YARR Academy could have made my presentation even better. First, time, careful preparation is key. Most likely you will have a very limited time to tell your story, and you will probably be part of a team. Our small team consisted of people who were receiving the experimental drug and people who were not. Each member was allotted a specific number of minutes to share what we felt was most important to share with the FDA. I devoted time and thought to the most important points to share, and then I made sure I spoke for exactly the length of time allotted by timing my speech first, not once but several times. Then our team had multiple conference calls where we were expected to practice our speeches again and again, making sure we knew exactly what order we would be speaking in. We practiced again the day of the meeting with the FDA. Second, speaking at the FDA is an emotional experience. Arriving at the FDA, I quickly learned that it is a high security agency. You can expect to have your credentials checked when you enter the parking area, and then again when you receive your name tags. You will also pass through a metal detector, and as you move through the building, you will be escorted everywhere. While presenting my speech and hearing others speak, I experienced great emotion. Not only was it painful to share my struggles with ASMD, but it was also painful to hear the struggles of others. It was difficult to hear how well the experimental treatment was working for others, and to know that it would be a long time before I would be able to access the treatment for myself. However, I knew my contributions to the powerful presentation were important for the entire ASMD community. Third, speaking at the FDA is an opportunity for decision makers to hear valuable information from you, and they take it very seriously. I was pleased to tell the FDA my version of what it was like to have ASMD, because I found that what scientists and doctors have published about the disease does not tell the full story. I have many symptoms not commonly reported, and the impact the disease has had on my life cannot easily be captured in a scientific paper. It was very powerful for the members of the FDA who listened to hear an actual person speak and see me in person. They listened extremely carefully and took many notes on what I was reporting and explaining. Fourth, speaking at the FDA was important not only because I was representing myself, but representing all of the people who could not speak for themselves. At first, I did not realize how important this opportunity would be, and I focused on my own role and how it was important for my life. But as we prepared across the weeks, I realized that I was not only speaking for myself, but for all of the people who had ASMD. I came to understand that what I was doing was extremely honorable and important, and it made me want to try as hard as possible and do the best job I could for the benefit of all those with ASMD. Over 3 years later, I had the opportunity to participate in the YARR Leadership Academy. I thought about my presentation at the FDA many times and how this could have helped me. YARR Academy preparation and active participation in YARR are invaluable in helping young adults with rare diseases to speak more effectively at places like the FDA. All of you as YARR Academy graduates will have developed many skills, including the following. First, you will have learned how to vary the length of your story. You may be speaking as part of a small or large group, and your allotted time to speak may vary. And if the meeting runs late or another speaker goes over time, it is important to know how to change up your speed of your story. You may need to spontaneously give a shorter or longer presentation. Second, YARR Academy participation will help you proofread and revise your speech. Without a doubt, YARR's feedback would have helped me write and deliver an even more effective presentation. And third, YARR members will have an informed and objective audience to practice with. Practicing by yourself or with a family member or people who know you well is not the same as practicing before an objective audience. And since the opportunity is likely to be once in a lifetime, it's worth investing in. Graduates, thank you for listening. I wish each and every one of you great growth and success in your rare disease advocacy journeys. Congratulations.
I really went into the YARR Leadership Academy not knowing much aside from legislative advocacy of the options that were available to me as a patient to have my voice heard. Through the YARR Leadership Academy, I really got to know that there are really a multitude of options in all different spheres of rare disease, drug development, and rare disease spaces that can and do want to hear my voice and that I can participate in. I appreciated that we got to hear from speakers from a variety of backgrounds, including those that had similar backgrounds to us as rare disease patients and those who work in the rare disease space. I found that getting this perspective helped me broaden my ideas of how things can be changed and also where my efforts can best be placed. I just really appreciate the community as well that the YARR Leadership Academy gave me. It wasn't just that every week we saw a different speaker, it was that every week we saw a group of like-minded people coming to engage with this speaker and learn from each other as well as the speakers that were brought in. And that was really valuable to see that I wasn't alone in yet another way.
I learned that there's a lot of ways to get involved in rare disease advocacy. I originally came in thinking that legislative processes were the only way, and that going to talk to congressional leaders was the best way to get involved in advocacy. And I still think it's a great route to go. But kind of learning about the different ways that you can get involved in the public and private sectors and talking to different people who have been in those spaces was really valuable. And seeing the way that therapy processes evolve was just a super influential part of the Leadership Academy, and seeing the ways that I could see myself getting involved in those different spheres was really, really, really influential. I had no idea that the Department of Defense had consumer reviewers, and then once I looked into it a little bit more, the disease that I've been involved with this whole time has that are specifically reviewed for, and then looking more into it, I realized that a lot of the funding that the DoD did was for scleroderma, and that actually helped influence the stem cell transplant that my mom ended up receiving. And so I just know how big of an influence it is. So I'm planning on applying for the next cycle in December. And it's just really inspiring to see the different ways people are involved in rare disease advocacy, and then seeing the different ways that we all have a very common goals, but go about different ways of getting there. And so I think the community that we built that is moving beyond the academy was probably my favorite part. I just want to say thank you to Every Life for putting this on. I think it's a really incredible academy, a really incredible space. And I'm just really thankful for the people who came week by week and for everyone who helped put it together, all the speakers and everything. So just a big thank you.
I really enjoyed getting to see different faces from the rare disease community. I think sometimes with my advocacy work, I see the people in YARR through the general meetings, and I see my specific stakeholders and government officials, but I don't get to see the adult figures that are working in the rare disease advocacy space. So it was really cool to see all of the different speakers who are doing advocacy and doing really important work, and get to hear from their perspectives and meet them and network with them. My sister and I are working on the Rare Disease Advisory Council in Indiana and creating it. Right now we're in early steps of more coalition building and trying to get connections to all sorts of stakeholders in Indiana and really learn about and understand the process in a little more depth.
So we learned a lot about patient representation and different elements of policymaking. We got to learn from a lot of different speakers from different parts of the rare disease community as patient advocates, representatives from organizations, learn about different kinds of leadership roles that they had taken on in their advocacy and the ways that different parts of policymaking, legislation, drug development, all the kinds of working parts that come together in the rare disease community. I really appreciated how many opportunities we had throughout the course to make connections with other advocates and other leaders in the rare disease community. It was great getting to connect with speakers from all different parts of the community and who've had so many different advocacy roles. And it was also just amazing getting to spend 8 weeks with other young adult advocates and get to make connections that we will get to carry forward into our own advocacy efforts and help support each other. So for my capstone project, I focused on the Rare Disease Advisory Council position. And I'm currently joining the Northwest Rare Disease Coalition to help support state efforts to create an RDAC. And with that, I've also been able to talk with other young adult advocates that I've met through the course to get a better understanding of what this role looks like when it's been put into practice in other states. And it's just been an amazing opportunity to get to explore these kinds of positions and state advocacy with other advocates who have that experience.
I think in the YARR Leadership Academy, the biggest thing I learned is that every person you meet and every relationship has value in the professional world. Whether it's just a good contact to have or somebody who can help you later down in your career, even if it's not incredibly apparent at the time of meeting them, you should maintain that respectful contact and you should keep in touch because it is going to be, you can never know when you're going to stumble upon that person again or create a mutual connection with them. So I think really just valuing and appreciating the people you meet in the rare disease space and in this world of advocacy. I think what I appreciated most were just the focus on soft skills, because we learned so many things, especially the resumes and really how to deep dive into policy. That's not something that you really ever have an opportunity to sit down and be taught. You're kind of always expected to know it, but school doesn't teach it. And it just the fact that we were able to sit down with experts and get that level of feedback where we could learn these skills that are so useful, yet so rare to find a formal seminar talking about. That was invaluable. I have a great resume now that I'll use probably and just continue updating for years. In advocacy right now, I think my biggest focus from this academy has been meeting as many people as I can meet. I'm not really at a firm crossroads where I know exactly what my place I want to have in advocacy is. I am new enough to it that I'm still kind of finding my own niche, but I really just want to get out there and get different experiences. And the Leadership Academy really gave me the contacts and the basic knowledge I noticed. It gave me the kind of the directory of where to find those experiences until I do find my place. So I'm just going to be moving around and seeing where I fit.
I learned more about the FDA and like their role and what they do. It's more just like food and how they do help like people in the rare disease community. And also from my capstone project about the newborn screening advisory council, I did learn a lot about that and like just learning like how like few diseases are screened for in like newborn children and stuff, like, and how you can like be able to like advocate to get more diseases screened for newborns. So that was probably the biggest thing from that capstone project I learned. You know, you think of like the rare disease community, but you don't think about all the different pieces that go into the community, like how everyone like has their role and like how you can change it in like ways you see that will help you and the community. Before YARR, I had like never mentioned my rare disease to like anyone. It's like I went through all like grade school, never mentioning like my rare disease to any of my friends or any of my extended family members. And like what this is like the YARR Leadership Academy has done, it's like it's allowed me to like begin that journey of like starting to speak about my disease and like speaking more about the rare disease community in general, because I was always like scared to mention it before. But this is like showing me that it's like okay to speak about your rare disease and like you should be like proud of it and be able to speak about it freely.
I love the power of rare connections. I learned about patient representation within organizations and why it's so important to have the voice of someone with a rare disease. It's useful when looking into policy too. I learned how the FDA has processes for faster drug development for rare diseases. I also learned that the FDA has opportunities for patient engagement, as well as the Department of Defense does. Mostly, I learned that younger individuals like myself do have the ability to make a change. I hope I can use what I learned in this class to further my own advocacy within the rare disease space. I appreciated the friendship of my fellow YARR students. It was awesome to make these connections and to develop lifelong friendships. All of our classes were facilitated so well, and the guest speakers were helpful and a great add to the learning experience. Finally, I enjoyed meeting and getting to know some of the graduates from the past years, and I will be using a lot of the knowledge I learned from YARR in my everyday life. After gaining lots of new knowledge from the YARR Leadership Academy, I plan to become a patient representative to yet another organization's board of directors. I currently hold a board member position on the Utah Rare Disease Advisory Council, so my next steps are trying to become a patient representative, a board member for the Fanconi Anemia Research Fund. I hope to bring all of my new YARR leadership teachings to all the organizations that I am able to be a part of.
I think I also learned how much solidarity there is within the rare disease community. This is like one of my first interactions with a group of other people who like all have the commonality of like having a rare disease. And I think like knowing there's such like a strong community and such a strong will to change things and make things better within that is really inspiring and definitely motivating for my work in the future. I really appreciated all of the different speakers. They really like elevated my understanding of the topics and like definitely like wanted our insight on it, which a lot of like the organizations like or like lecture-based things I've been in the past aren't like that. So I thought that was really unique and interesting. And I also loved how encouraged we were to collaborate with each other and build up like a community with each other. I know I've talked to 2 people just from doing those presentations that we did on the last day and like having like common interests within that. And I think that's really unique and something I really enjoyed doing. I'm just very appreciative that I got this opportunity. I believe I was like on the younger side of this thing, and so this was one of my first like professional experiences, especially with like real policy advocacy. And since that's something I want to do like as a career, that gave me such a head start, and it's given me such a good perspective, like even in my college classes and even just like as I like move through political spaces in general. And so I'm just very appreciative of the opportunity.
I really enjoyed learning about the FDA. It was the whole like timeline of the FDA, of that it's like barely even 100 years old, and that we basically have to renew the FDA every like 5 or so years was just mind-boggling to me. The thing I appreciated most was getting to know more people in the rare disease community, particularly people my age. I find that a lot of times people in the rare disease space are a lot older than me, so we tend to have very different experiences. And I don't think I can overstate how nice it is to know that I have the support of my fellow YARR graduates. So for my capstone, I chose FDA patient representative, and I will be applying for that, so very exciting. I'm also starting a nonprofit, so big things ahead.
I learned a lot about like the ecosystem of the patient world and like how it relates to the pharmaceuticals and the nonprofits and all of the different organizations and parties involved. My capstone for YARR was about the WFH, World Federation of Hemophilia, Data and Demographics Committee, and I was applying for a membership role. So basically they have this huge survey that tracks hemophilia, which is the bleeding disorder I have, and different bleeding disorders around the world in different countries. I just have a lot of passion for increasing equality for people who are not prioritized within like policy, government, the world, systems that provide us like with our basic needs, and especially for rare patients, our medicine. Looking back, I feel like I really appreciate the structure of the program, the facilitators, Courtney and Lindsay, and my peers, as well as the presenters, because I feel like it was an environment in which everyone really wanted us to learn and grow as people.
I had the most fun learning about like the payer system and like how the world of insurance is understood. And I feel like that's where I learned the most content-wise, but from a more holistic perspective, I feel like I just learned more about the ins and outs of rare disease advocacy, and I was able to make some very good connections with some fellow peers, which was very nice. In this space, I've only really interacted with people who are of like middle age or older, and so it was just a unique perspective to be able to interact and hear from and make connections with young adults in the field. Currently, I'm involved with the Patient Advisory Council for the FDMAS Alliance, which is the Fibrosis Dysphagia McCune Albright Syndrome Alliance, and that's how I'm continuing my advocacy going forward. But in the future, I would like to do more policy advocacy and eventually see myself being a politician on the Hill. I would like to say thank you to all the people who sponsored and hosted the Academy, because it was a very worthwhile experience and definitely could not have done it without them. And I'm also very thankful for everyone who participated in the program with me, because it would not have been as valuable if it wasn't for those peer connections.